Welcome back to Earth Mind of Channels. Today we'll be discussing about something that every woman of childbearing must know. And what is that? Drug unsafe during pregnancy. And this drug unsafe during pregnancy is also called teratogenic drugs. And what is this teratogenic drugs? Teratogenic drug is their medication that can harm developing babies in the womb, which can cause birth defects, organ damage, even miscarriage. And these teratogenic drugs can even cause structural and functional abnormalities in the fetus. Even this drug, teratogenic drugs, is using early in pregnancy. It can cause a lot of things. Even before the woman realizes she's pregnant, the drug has already harmed the organ permanently. What are these drugs that are harmful to pregnant women? Number one, we have ACE inhibitors and ARB drugs. ARB drugs, and these two drugs, they are antihypertensive agents and which are used for high blood pressure. But these two drugs, they are avoided from pregnant women because it can causes kidney damage and low amniotic fluid, and also causes skull defect in the brain, skull defect in the brain. And this there's also tetracycline. There's also number two is tetracycline. Tetracycline is also common antibiotics that we all know, but this drug is avoided from pregnant women because it causes tooth discoloration and slow the bone growth in the baby. And there's also these drugs which is called aminoglycoside. Aminoglycoside is also antibiotics. We have gentamicin, streptomycin, and these drugs, they can affect pregnant women, and they are avoided from pregnant women because it causes what? It causes deafness in the deafness in the baby, and also damage the kidney. It also causes kidney damage. And there's also vaporic acid. Vaporic acid, this and phenytoin, vaporic acid and phenytoin. These drugs, they are uses for epilepsy people, but they are avoided in pregnant women because it causes neural tube defects and cleft palate and growth retardation. That is why these drugs are avoided from pregnant women. And the number five is isotretinoin. This is vitamin A. This drug is a vitamin A drug used for acne, and this drug are avoided from pregnant women because it causes facial and heart and brain defect in the baby. And even a pregnant woman on this drug, a person on this drug that is on this drug must not what must not be pregnant during this drug because it will affect the baby. Number five, we have warfarin. Warfarin is an anticoagulant agent, also a blood thinner, but it is avoided from pregnant women because it causes nasal deformities and fetal bleeding. And there's also methotrexate. Methotrexate is also used for arthritis and cancer, but it is avoided in pregnant women because it causes brain and skeletal malformation in the baby. And we also have NSAID. NSAID, they are analgesic drugs like ibuprofen, in indomethacin, but they are avoided from pregnant women because it can lead to premature closure of the daughter's arteriosus, which can lead to the what? Can lead to the kidney damage in can lead to the heart failure in the baby. And we also have androgen and danazol. Androgen and danazol, these drugs, they are avoided from pregnant women because it causes masculinization of the babies. Thereby, the baby will be having characteristics of male like deep voice and enlarged genitalia. When are these drugs mostly dangerous? These drugs, they are mostly dangerous especially during the first trimesters. This these periods, they are the most critical period because that is when the baby organ is formed. But the second trimesters can lead to the growth retardation during the what during pregnancy, and the third trimesters can lead to the drug toxicity, can lead to drug toxicity, and also causes withdrawal effects after birth. And how does these drugs affect the babies? Some of these drugs, they have different mechanism. Some of them affect the cell division of the what of the baby. Even some affect what? Some affect the folic acid metabolism in the what? In the fetus. And why some reduce the what? Reduce the blood flow to the what? To the placentas, like ACE inhibitors. They reduce the blood flow to the what? To the placentas. And some even affect the what? They affect some causes toxicity to the what? To to the bodies when the organ is forming, like fabric acid. That is when it causes what? Brain defects. What are the things that a pregnant woman or those people planning pregnancy should do? Number one, always inform your doctors or pharmacy if you are pregnant or you are trying to conceive, so that they'll be able to know the type of drug to prescribe. Number two, avoid self-medication. Even the over-counter painkiller or drugs can be risky. Number three, always take folic acid before or early pregnancy. And number four, if you are on long therapy like epilepsy or hypertension, talk to your doctors early to switch to a safer drugs, so that it will not affect what? It will not affect your baby. Remember, every medicine is prescribed during pregnancy, not girls. So remember, not all drugs are safe during pregnancy. Some that eat the mother can harm the baby. And always what? Always check, always ask, always follow the medical advice. If this video is helpful, don't forget to like, share, and subscribe. See you in next episode. Thank you.